Good morning, ladies and gentlemen. We'd like to start the meeting. Sorry for the delay, but as you know, we have a lot of people on today. So I do want to welcome everyone to the joint meeting of the Brooklyn DD Council and the Brooklyn Advisory Council. Welcome everyone. Before we start any regular meetings to regular updates, we do need to remind everyone with housekeeping rules because we are having a lot of people at this meeting today. So please, as everyone is coming in, I just want to remind everyone, the housekeeping rules are very important. People on the computers and tablets, please be advised that you must make sure that you're muted on your computer and your tablet. Get to know your devices in the bottom. On the left, you see a microphone that's supposed to be there. You see a camera if you're using it. There is a panel, which has number 41 now, which is changing the numbers. You can click on that and you will see a picture of a hand. The hand will look like somewhere like this. Please, everyone, for your courtesy to everyone, please raise your hand if you're on the tablet. It is very important. Also remind everyone, any questions, click on panel, raising your hand. That's also available. Or you can type in the chat and say, I have a question if you're having a problem, if you can't turn on your microphone, or you want the question privately. Please put that on the chat as well. But make sure it goes to the host only, not anyone else. As a reminder, everyone, please keep yourself muted unless your hand is raised, and you please identify yourself. Also remind people on the phone, *6 is to mute or unmute. Please make sure you follow that instructions very clearly. *6 is to mute or unmute. When you're unmuting, that means your microphone is on. If you have a question and you're on the phone, please raise your hand. It is very important to raise your hand. The hand will come up on the phone. And when we identify you, the people on the phone, please, when we say your phone number, please unmute yourself on *6. As a reminder, everyone, please, if you have an announcement today's meeting, please put it on the chat so we can make sure everything is up to date. And as a reminder on the announcements, please, if you have an agency opening or any information you'd like to let us to put on the website, please make sure that information will go to us by the end of this Friday. Every Friday, the website opening, which is the opening or training or events, will be always updated starting that Friday and during the weekend. So please make sure you visit that website so make sure we have all the information at this time. So as a reminder, everyone, please use your hand if you have a question for the speaker or any of the agencies, or for IAC, DDRO report, the chairperson's report, and subcommittee report. We do want to make sure the meeting runs on time and on schedule, as we possibly do. Now, before we start the meeting and everything else, I have to do a few minutes of silence. As a reminder, everyone, we know that some of our families, or some individuals did pass away due to coronavirus. We are very sorry for those families, but we do have sadder news that came in. As some of you know, some of the self-advocacy groups are very in mourning right now, including me, as well as Deborah. We are very sorry that Edith Prentice, who was an advocate, who was one of the speakers here many years ago when Paul Fasone was the chair, Edith Prentice died over the weekend, not this weekend, but the following weekend. Edith was one of the advocates to advocate not just transportation, but everywhere in the New York City region. So we ask that rest in peace, Edith, and we are very sorry that we lost a very strong advocate who also advocated from health, education, voting rights, accessible taxis, and yes, transportation.
And she also voted for accessible housing.
Yes.
For anyone with disabilities. She advocated for everyone.
Yeah.
and her knowledge and her spirit. We will miss you very much, but thank you, Edith,
Mhm.
for starting this advocacy.
Yeah. And as of 1 year ago, you may have heard, Cal Fischetti was, when it's come tomorrow, will be the 1 year anniversary of another legendary advocate, Cal Fischetti. As you know, neither of these two legendary advocates did not pass away by coronavirus. So we all both going to say we will miss both of them, and we do ask for both of these to be a few minutes of silence as a respect to the families and every advocate. We'll miss both of them very much, but as I say before, you may heard it, the legacy will still continue in ourselves, and we will miss them very much, and including our individuals, families, brothers, sisters, uncles, everyone. We ask everyone to please have a few minutes of silence. I'm sorry, so my microphone must be acting up. But again, we need to make a motion for the minutes. Second, we have Deborah Wright making the motion.
I need a second.
I'll second.
And
And
Menino.
okay, and Menino, thank you.
Thank you.
Okay. 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 Before we start our speaker, Joyce, are you there? Joyce Levin? Joyce? Joyce, you there? I unmute you.
Okay, you have to unmute me.
I just did.
You're on.
Okay.
Yeah. Joyce, you want to do your report quick? Because I know you have to leave certain time.
Yes, I will. Thank you, Chris. Good morning, everybody. Sorry, I'm not on the Zoom. On phone because I do have to leave for a meeting. But good morning to everybody and happy spring. I just have a couple of things I wanted to mention and go over. First, just a real quick recap of the virtual rally, breakfast, legislative rally that we had on March 5th. It went really well. And I want to give a shout out to Roxanne Prasad and Andrew Granadis, who actually came on. Roxanne spoke live in support of our priorities, and we want to thank her for that, and thank any of the legislators that might have come on that didn't get a chance to speak. I had actually a small group. We met with Roxanne prior to the rally, and she's fantastic. And I know she's carrying through our message in the state assembly, Senate, along with Senator Mannion, who's a real champion for us, and hopefully it'll turn out in the positive. I also want to give out a shout out to Matthew Estep, who was instrumental in setting up Brooklyn's uh, ability to have the rally and the registration. And I really want to thank him for that. And also to Rochelle Kivanowski, who was the moderator, and she did a fantastic job. So thank you to both of them. And speaking of that, and I don't want to take Richard Bosch's thunder away, but today there will be a rally, another rally at 12 o'clock. Hopefully most of you got the email about that. And it's hashtag care, not cuts. We have to keep the pressure up on the Assembly and the Senate to ensure that we're a priority for them, and no cuts to the supports and services for the individuals that we serve. There are proposed $335 million in cuts to services, which would be detrimental and a threat to the health and safety of everyone that we serve. The pandemic has wreaked havoc on agencies' budgets. Agencies have had to buy PPE supplies out of the very limited resources that we have. We've got no reimbursement for that. We've had to pay staff overtime and hazard pay. And again, there's been no recognition by the commissioner or the governor of those monies that had to be invested, but agencies did it because that's what we needed to do. And we need to make sure that these cuts going forward don't happen, and that the COLA stays in the budget. It hasn't been in there for 11 years now. So that means we have not been able to give increases to our direct support staff, except for the Be Fair to Direct Care. But that doesn't go very far at this point, and we need to begin to give regular COLA increases. And we have a good shot, hopefully this year, of the COLA staying in the budget. And we need to keep the heat on the State Senate and Assembly to make sure that we're not the forgotten people in this year's budget. And Richard, I'm sure, will talk more about that. I just also wanted to mention, and Mary Christopher is going to talk more about this, but through the transition group, there will be a meet and greet on April 21st. And Mary, myself, and a couple of, actually Matthew and Joy and Carrie Banks, we've been working for a couple of weeks now on setting up this meet and greet. Mary's taken the lead, contacted agencies, so they would be able to give a little 5-minute information session to aging out individuals, families, care managers, and anybody else who would want to join. And we hope to have everybody on. The only request I have, and I don't know if Mary has a contact yet, but we haven't been able to get in touch with anybody from ACA. So please email me any information if anybody's on from ACA. It's imperative that the CCOs are on the call. Mary has confirmed with the other CCO agencies, but I know that we've had difficulty getting in touch with somebody from ACA. So somebody please email me information on who to contact to ensure that they're on the meet and greet. It's April 21st, and Mary will talk more about that. And that should be really good. Basically, that's all I have. Again, I don't want to steal people's thunder and take too much time away from the great speaker that we have. And I'll turn it back over to Chris. Thank you very much.
Joyce, just to let everyone know, we just received a leaflet, and I'm just letting everyone know that I will be sending it out later on this evening, because I will be leaving early as well. Debbie will be doing the rest of the meeting. So I just want everyone to know that the leaflet will be going out ASAP by this evening, and I will make sure it's all, all ready to go, 1, 2, 3. And it will be also available on the website later tonight as well.
Chris, can we share the link to the?
Okay, guys, there's some of you guys. If you have a question, please raise your hand because we can't just be on mute and I can't very hear you. Joyce, you have just to let you know, Joyce. Also, Tammy Brown is here on the video somewhere because we have almost 50 people in attendance.
Great.
Tammy Brown is here today. It's going to be a little hard to find her because it's everyone here. AC?
Tammy, you're from ACA. Can you please, you, good morning, Tammy.
Tammy, are you there?
Still here? Please unmute.
I'm guessing she's not here, but Joyce, you have a question from someone else, Maria Mark. Go ahead, Maria.
No, I just wanted to thank everybody for having this meeting this morning, and I have to hop off soon, but I also wanted to, very much give all my condolences to every single disability advocate in the city, because I know with the passing of Edith, that was such a major, major blow. So I just wanted to say that before I got off.
Okay, thank you, Maria. We appreciate that very much.
Okay. Let me lock my hand. All right, Joyce. I'm gonna now get to our speaker. Is that okay?
That's perfect.
Yeah. Sorry. Let me. Okay, ladies and gentlemen. Let me just move back to our regular screen. That's better. Let me just. Oh, and there's one thing, Joyce. You did forget. Some of you may have heard this before, and Joyce, I'm glad you're here also because this will be mentioned. As you know, we want to congratulate Deborah Bright for this month. It's Woman of the Month. Don't follow me. That's just the thing.
Woman of the Year. Woman of the Year. I absolutely forgot, and I'm very sorry.
Algie accepted.
It's crazy.
Oh, but Deborah, it's a wonderful, wonderful that honor that's been bestowed upon you, and thank you so much for all your advocacy, and enjoy the moment. It's a wonderful honor.
I'm going to make this really quick. Joyce, thank you. Everybody, thank you. I was very shocked to get it because I do work with now Assemblywoman Frontes, but I'd never expected that because my advocacy is done because I love my son and other families and who need help, and that's why I do my advocacy. So thank you so much.
And we'll just move.
Thank you.
Mm-hmm. Thank you. And just let everyone know, this will be live on Facebook. I will send, if anyone's interested, can email me and I will send you that information. Now, as a lot of people have been asking this question during the CCO committee, as well as other areas, we want to welcome Anna. Are you there?
I'm here. Hi.
See?
We have Anna Schatz.
Anna Schatz.
She's the community coordinator for South Brooklyn and Staten Island, the Office of External Affairs, New York City Department of Health and Mental Hygiene, and she's our guest speaker today. And appreciate because Anna has been working very closely with the New York City Mayor's Office of Persons with Disabilities, better known as MOPAD. And we thank you very much for accepting our invitation to speak today to the Joint Council. Anna, please take it away.
Thank you so much. Thank you, everyone. Thank you, Chris, for inviting me, and I'm happy to be here. I just want to say two things. First of all, we do have to get off at 11 for another meeting that we have to get on, but I'm joined today by Dr. Mattery Ray, who works at the intersection of medicine, data, health equity, and public health in the New York City Department of Health and Mental Hygiene's fight against COVID-19. And prior to working at DOHMH, Dr. Ray completed her MD at the Drexel University College of Medicine and trained in general surgery at the Massachusetts General Hospital and the University of California in Los Angeles. He additionally completed a master's in public health from the Harvard T.H. Chan School in Global Health with a concentration in humanitarian studies, ethics, and human rights, and was a Fulbright scholar in Ukraine during the Orange Revolution. So I'm really grateful and fortunate to have Dr. Ray here with us, and she'll be able to help answer some of the questions that might come up later. I want to start with a brief presentation using PowerPoint. Oh, the screen share hasn't been disabled. It was working earlier. Can you grant me the screen share capacity again?
Yeah, Anna, I'm on the share. Let me stop my share.
Oh, okay, that's what's happening. I see.
Yeah, that's the thing. Once you share a screen, you gotta stop it and then reshare it.
Yeah, perfect. No, I just tried it earlier. It was working. I apologize. Okay, thank you so much.
Yeah.
So I'm gonna go through these really, really quickly. So here is a map, and again, all this information is on our Department of Health website. This is just a PowerPoint to pull everything together into one place, but we will share links with Chris after this to share out with all of you so you know where to go to get the most up-to-date information, because all of this gets updated daily, and therefore going to our website is the best bet for the most recent that's happening, especially data. So here we're looking at data. This is a 7% positivity map on the left. The darker the red, the more, the higher the percent positivity that is happening in the city. And as we see, it is some areas are darker than others. And if we look over to the right, we're seeing what it looks like in a on a graph in terms of 7-day average of probable cases, of total cases, and this is our second wave that we're looking at. So although things are slightly starting to go down, it is not a smooth downward curve. It is bumpy, and therefore we see that two things. First of all, we do know how to get things down. We know the things that work to lower the percent positivity, to slow the spread of COVID-19, but also that we still need to be better at it. And if we go over to the next slide, we could see the steps that we've been doing since the beginning of the pandemic. They all still hold true in how we can stop the spread. So these are the core 4 that you might have been hearing, the core 4 of staying home if you're sick, of wearing a face covering when you're outside your home, keeping a 6 feet of distance, especially with those that are not your household members, washing your hands often, using hand sanitizer when that is not available, and getting tested, right? So if you're not feeling well, if you feel like you might be getting sick, if you feel like you might have been exposed to someone, you can go ahead and get that COVID test so that you know how to act afterwards. And then also get linked to all of the resources that Test and Trace has to offer, especially the take care resources in getting a hotel room if you need it, getting food if you need it, and having someone come over and help you walk your dog as well while you're doing that. And then there's also the Commissioner's Advisory for older New Yorkers, people with underlying health conditions and their household members and caregiver, basically urging folk that not only those that are at higher risk of severe COVID-19 need to be extra vigilant and careful, but also those that live in the same household with them. And then, underlying health conditions can also mean, smokers. And that's might be not something that folk really think about, but this is just as important that everyone within that household is taking extra steps, extra caution to follow the core 4 and making sure that everyone is as safe as possible. In terms of wearing face coverings, we have an updated face covering guidance that's on our website that is basically letting you know how to do an extra layer of protection in terms of protecting yourselves and also others. As we know, COVID spreads through air droplets, and having that extra layer of your disposable mask first, that little surgical mask that is now easier to get at pharmacies and such, and then wearing your cloth face covering over it, making sure it covers both your nose and your mouth. And especially with some of the variants that we have, they're they're more highly contagious, and therefore we want to make sure we have that extra layer of protection. And then we have a graphic about how to wear it available on our website. And if you want, you can call 311. We can print out a bunch of these graphics and mail it over to you so you can hang it around any of your common areas to remind folks. And this is Our Lady Liberty, who has received her vaccine and is wearing her face covering, reminding us that the vaccine is here. We finally have that little light at the end of the tunnel, and they are safe, free, and easy to get. To date, this is from yesterday morning. The data will be updated as we speak right now, so we don't have the numbers here on this presentation. But these are the numbers of the vaccines delivered to New York City for both the first and the second dose, and then those that have received the first and the second dose already. And again, we post this to our website. We want to be as transparent as possible as to our progress with this. And also we want to be transparent as possible about the distribution. So this is a graph that shows the breakdown of adults vaccinated by race and ethnicity and age, including adults for whom race and ethnicity was unknown. This is inconclusive data because not every location has let us know all of the demographics of those that have gotten the vaccine. But even with that, we see that this is an overwhelmingly white population that has been getting the vaccine, both New Yorkers and non-New Yorkers. So therefore, we want to make sure that we hold such conversations in all communities and encourage folk to come out and create ways to enable better access to vaccines. And then if you have any kind of specific questions about that, Dr. Ray can talk further to it as she's deep into this work at the Department of Health. Here's another graphic about the vaccines, and this is just another way to show how this is spread out. So on the left here, you have a zip code breakdown of those who are fully vaccinated, and then on the right are those that have at least the first dose. As we know, for the mRNA vaccines, the Pfizer and the Moderna, doses are necessary, so that is why we have the two graphics. So the at least one dose means have gotten at least the first shot, and then the fully vaccinated means you got both of your shots. And if we go back to back, we see sometimes that some locations that have a higher positivity rate around the city also are having lower rates of vaccinations in the city. And we want to make sure that, those have struggled and suffered and had the impact of COVID affect the neighborhood at a higher rate are also then able to and are motivated to go out and get vaccinated. So as time goes on, we just hope that these maps get more and more blue with each passing day. Talking about vaccines, we have the New York City Vaccine for All campaign. Again, we want to focus on equitable distribution, including acknowledging history and current experiences of racism and bias in healthcare, and communities significantly impacted by COVID-19. It is real. It is not just historic. It is current. That is ongoing, and want to address all of these concerns, and we want to make sure that we drive our work through this equitable lens if we take care of all of these biases and inequities throughout the city, which some of them are, most of them are systemic. We want to work on ensuring both access and confidence in the vaccine to help address this. And then we have a vaccine command center, which is an interagency effort between several New York City agencies that are working on this. And we partner with federal, state governments, community elected city agencies and sector partners to help us with this work. Just to talk about the vaccines, again, reminding they are safe. They have undergone rigorous testing. No corners were cut in the clinical trial processes. They are recommended even if you have had COVID-19 or have antibodies. The only thing we ask is that if you are currently sick, that you stay home while you're sick to make sure that you don't infect everyone at the vaccination site. But if you are currently eligible, then it is recommended for you to go and get vaccinated. And then once you do become eligible in the future, you can also get vaccinated after you already had COVID-19. It'll give you that extra layer of protection. It does not contain the virus, and it will not alter your DNA, which is some of the things that we've been hearing as concerns. There are 3 vaccines that are currently holding the FDA emergency authorization. They're the Pfizer, the Moderna, both are the mRNA vaccines that require 2 doses, and making sure that both doses are of the same type. If you have Pfizer for the first, you get Pfizer for the second. If you get Moderna for the first, you get Moderna for the second. I apologize, my little coworker is getting into the screen. And the doses have to be about a month apart. And then we have the Johnson & Johnson, which is an adenovirus vector vaccine. It only requires 1 dose, so you don't have to schedule your second dose for Johnson & Johnson. But again, after you get vaccinated, you have created that protection for yourself, and therefore we still need to wear our face coverings and follow all the core 4 principles to make sure that we are still protecting all others around us. And the vaccine, it is allocated to us by the federal government who manages the distribution. And if you go on the website that is listed here, and again, I will send this over to Chris to share with you guys, because I know the chat box is disabled here. You can see all the information in terms of the data, who's eligible, and how it is getting allocated to New York City on our website. And the supply is limited, and as we get more supply, we'll be able to get more sites, we'll be able to get more appointments up, and we'll be able to vaccinate more New Yorkers. It is a phased distribution based on CDC guidance, and New York State is the one that determines the eligibility group, so we have to listen and wait for the signal from the state. And currently it's healthcare workers, those that are 50 and older, residents and staff in nursing homes, homeless shelters, and other group residential facilities, certain essential workers, certain public-facing government and nonprofit employees, and essential building service workers and people with certain underlying health conditions. An extensive list of who falls into all of these categories is on nyc.gov/COVID vaccine distribution. And it does get updated as we get more information from the state, but basically it is, the priorities are for those that are at either a higher risk of severe COVID-19 or at a higher risk of exposure to COVID-19. But in the next couple of months, mid this year, we anticipate that absolutely everyone will be eligible to get it. And again, as we get more supply, we'll be able to get more appointments on. And we want to enhance access and build confidence in the vaccine. So again, the response has been grounded in equity and this focus, not just with the COVID-19 response, but the focus on the vaccine distribution. Now that we have the vaccine, is also being grounded in equity. And a successful equitable distribution means enhancing access and building the confidence in folk of making the decision if they want to or not want to get vaccinated. The data on uptake so far shows us disparities, which does reflect national trends and reflects the trends that we've seen in the city throughout the pandemic itself. So we want to prioritize prioritize those neighborhoods and the eligibility groups. And we want to, make sure that everyone has the information and has their questions answered. That is why I'm also happy to be here to answer some of your questions along with Dr. Ray, so that you can take these messages and help share it within your neighborhoods. And we have a racial inclusion and equity task force that was 27 different neighborhoods. We have increased it to 33 throughout the city. And to make an appointment, you can go on to vaccinefinder.nyc.gov for city-run sites, and you can also call 877-4NYC. And if you go on the Vaccine Finder website, you can also find non-city locations. Everything is listed. Each location is responsible for their own appointments. That's why you'll have to go to each separate site to either call them to make an appointment or to go on their website to make an appointment. But if you call the 877-829-4692 number, you'll be able to have a person that can get on. There's language access available if needed to help you make that appointment and find a location for you. And then on our website to improve our user experience, we also now have a note under each location saying if they have available appointments or if they have only if they don't have any first dose appointments available either, so you don't have to go to each one and waste your time. And if anyone needs transportation to a location, you can call that same 877-829-4692 number, and the transportation can be arranged not only to the city-run sites, but to any of the locations that offer vaccines. Again, hope that you all that are here with us can also become trusted messengers to the community to help us spread the accurate information and then help navigate folks to go to the sources of accurate information. One of them are our website or state website or CDC that has plentiful information, guidelines, and posters and images that you can share on your social media as well. If you would like us to join you at any one of your meetings, let us know as well, and we'll help arrange that. There's a lot of different videos on our YouTube page, both of our commissioner and Dr. Easterling, and having different PSAs that you can listen to. And then there's also an extensive Vaccine 101 presentation that you can also watch to help you learn more about the different types of vaccines and how they have been developed. And I'm going to close out here with a reminder to please follow your core 4. We're still very much in a pandemic in our second wave. So we want to prevent any further waves from coming. And the way we can do that is by following core 4 and getting tested and learning more as more information is available. And I hope everyone takes a moment to think about if they want to get vaccinated and check out all the resources that we have here. And I'm happy to pass it over to Dr. Ray here, who will help with the Q&A. Thank you.
Anna, this is Chris. Just going to ask you, I'm going to share screens back, but if anyone has questions, can you all please raise your hand? Or so therefore we can make sure that everyone, we can answer the questions as quickly as we can, because I know that our doctor and Anna do have to run to the next meeting at 11 o'clock. So I'm just going to ask everyone, if you have a question, please raise your hand. This would be a good time. So please do that. As I'm changing the screens back to normal, to the other way around. Joyce, do you have a question? Joyce, you have to star 6 yourself. Joyce, are you there? I got you, Joyce. Hold on. Go ahead, Joyce. You're on mute, Joyce.
Yeah, I'll answer.
Go ahead.
Anna and the doctor, now that it's been announced that individuals who live with developmental disabilities who live at home with their families can go get the vaccine. So they can go anywhere, or they can be limited to DD clinics.
Dr. Ray, do you want to take this question?
Sorry, I actually, the audio didn't come through. Could you repeat
right.
that question?
Sure. This is Deborah Greff. I'm chair of the Brooklyn Fem Support Service Advisory Council. My question is this. Individuals with developmental disabilities now who do live at home with their families, receiving family support services, OPWDD has said that they can now also get the vaccines. Are they limited only to the DD clinics, or they can go anywhere also to get a vaccine? I mean, of course, make an appointment, but are they limited to where they can get the vaccine?
Yes, so I think that if you go to our website, which we can share the link, we have a really nice eligibility website, which is updated really frequently, and that's nyc.gov/COVID vaccine distribution. And I believe that many people with developmental disabilities will qualify under the general sort of the general characteristics, even if they're living at home. So they might fit into any of those categories. People in the general categories can go to any of the city sites or any of the health and hospital sites. I know that some of the sites, for example, in the pharmacies and stuff, are only able to serve a subset of patients, and some sites only serve their employees. But I think that just having a developmental disability, specifically an intellectual and developmental disability, including Down syndrome, qualifies as a regular underlying health condition that should qualify you to go to most sites. I think that there's been a little bit of confusion, and different sites have different requirements. If you go to one of the New York City sites, all that is required as proof of that underlying health condition is an attestation where you say, I certify that this is true, or a representative, if appropriate, certifies that that's true. Certain medical sites, I think, do require some sort of doctor's note, but if you go to the New York City vaccination hub, you will not be required to provide a doctor's note.
Okay, thank you.
Joyce,
No
are you?
problem.
Yeah.
Wait,
Joyce, are you back?
Chris?
Yes,
we
Joyce.
got you.
We got you, Joyce. You have a question?
Can you hear me?
Yes.
Oh, okay. No, I don't have any questions. Thank you.
Okay, I just wanted to make sure. Carrie, you're next.
Thanks, Chris. I just want to remind people that Brooklyn Public Library can help seniors and people with disabilities make appointments. Navigating that, the website is very difficult for a lot of families. So I've put the information in the chat, but I'm going to read out the phone number. If you need help making an appointment, if you're a senior, an older adult, or a person with a disability, and you need help making appointments, someone who can just go through the online process with you while you're on the phone, please call. Ready? 718-236-1760. Or email healthy, BKLYN, at BKLYNlibrary.org. And I do want to be clear, this is for Brooklyn. I mean, we're not going to ask on the phone where you're from, but we have limited staff doing this. So we are focusing on Brooklyn.
Carrie.
Thank you, Carrie.
Carrie, there was a question that you did. I'm actually glad you brought that up, because a lot of the families that been going to you guys, and they do want to thank you.
It's made it a lot easier.
and actually you took 30% of the pressure down.
I'm
Or
glad we
op-
can help.
Yeah, it's called more options, more directions. So
Yeah.
thank you so much, Carrie, for bringing that up.
Happy to help.
Thank you, Carrie.
Let me. Does anyone else have a question for the doctor and or Miss Anna? Joyce, I hear you singing music.
No, no, sorry. No.
Okay. Since no one else has any questions for the doctor or for Anna,
We want to thank both of you
Mhm.
for your information. Your information you sent to us will be shared
Mhm.
very shortly on the Brooklyn Families Court Service Advisory Council's website.
and it will be emailed
Email
tonight.
tonight to everyone. Again, we thank both of you and appreciate your help. And please also let your partners know that persons who live at home with developmental disabilities qualify now to get the vaccine. Because we want everyone to get vaccinated for their health. Thank you again.
Anna, you there?
Are you there, Anna?
I'm here. Thank you so much, everyone.
Yeah,
Thank you.
We want to thank you because we appreciate this. But it's very important because I did tell OPWDD, because I represent Brooklyn Upstate, we told them to please allow New York City and all their partners, including pharmacies, to know that individuals living at home can get the vaccine if they have a developmental disability.
Yes.
So we'd also appreciate if you can put the word out too for us. It would be a very big help.
Thank you so much.
Thank you.
Thank you.
And thank you, Dr. Ray, for joining me today as well.
Yes,
Thank you, Dr. Ray. We appreciate that too. And we know you have another appointment to go to and another. Thank you so much for your help. We appreciate it. Thank you.
Thank you.
Thank
Okay. Take care. Bye.
Bye, Okay, folks. Now let's move on to our favorite. It's our favorite time.
It's IAC. Richard, are
Rich-
you here, Richard?
Richard's always here.
Hi, Richard.
How you doing?
Hey, Richard, I have to say, you look so. Look, there's another Richard of you.
There's twins. Are you twins? You see on the screen? He did it. I didn't.
It's only fair if Tom was on it, Winnie was on it. They told me to make sure you look and say, update IAC from Richard, and he's at.
Okay.
Chris did it.
Well, I'm happy to announce that Saturday I get my second dose.
Woo-hoo!
Congratulations. I'm glad.
In case you didn't know, I live in New Jersey, and it is not easy to get an appointment in New Jersey.
Yes,
It's-
we're aware.
It's getting easier, but I actually had to have my daughter hook me up with a Facebook group that gets people appointments. So after Saturday, my anxiety level will go way down. So most of my friends and coworkers in New York City have been vaccinated already. So this is one point where I wish I was in New York City again. Just to let you know, I've been part of this field for 47 years, which is probably more years than you are old, most of you. And it's been a real privilege, and it continues, and the advocacy effort has been just incredible. Joyce mentioned before that at noon today, NIDA, New York Disability Advocates, which is a conglomeration of all the provider associations in New York State, they're having a rally at noon. The theme is Care Not Cuts. And then on tomorrow evening at 7, it's time for the early childhood and education parents. They're having another town hall meeting. Back on March 11th, there was a town hall meeting. Thank you, Chris. And from this meeting, a group called Caring Parents took off. It was just amazing to see all these young parents, of young children with special needs get together, and just the energy behind it was amazing. So if you're able to, join tomorrow evening at 7. And their theme is investing in me is believing in me. And again, it was just quite inspiring, and they've got the energy behind them, and hopefully they'll keep going, which I'm sure they will. This past year, our annual lobby days was virtual, which was a new experience, but for some reason, it was more successful than usual. It seemed to be more personal, speaking with the legislators, face to face in the camera, and almost everything that we were advocating for is in either the Senate's one house budget or the Assembly's one house budget. And I'd be glad to go through that. Chris, if you want to, can you put up the one house budget? That's a nice mask you got, Chris. I've got to get one of those.
Unfortunately, Richard, I had a problem because it's on a Microsoft Word. To do that, I had to switch it. I didn't have time.
Okay.
Chris is leaving right now,
And
and
I'm
I'm going to do my best, Richard.
So let me see.
Yeah.
See if I can do it.
That means I have to stop the share.
Okay, there it is.
All right, let me switch. Go ahead, switch again.
Switch what again?
Click on share on the bottom.
It disappeared. Oh, there it is.
Yeah, once you click on share, it will work.
It did work. Now it's gone away.
See that's
Oh.
I think that
Chris, I'm sorry.
it's okay. So I'll just switch back, but that information will be I'll be sending that out as again tonight. You still there, Richard? There you go.
I'm still here. What'd you do to my sharing screen? You made it disappear.
No, it's actually because I'll do it again. Go ahead, try again. You have to click on share.
Yeah.
From the share, once you click on the share, it will see where your thing is. But if it doesn't work, the Microsoft Word may not work.
Yeah, you clicked on it and made it go away. And now it's not on the bottom of my screen. So let me just go through it then.
Mm-hmm.
I'll hit share. Oh, share your screen. Yeah. Okay. Let's get rid of that. And let me just go through it.
Go ahead. I'll just go right.
Okay. So what I'm going to do is go through the OPW section, and then Department of Health, and then State Ed. And I'll spend most of my time on the OPW and then State Ed. And Chris, how much time do I have? Because I don't want to overdo it here.
Let's say you have like 6 minutes, because I know Delia's here today.
6 minutes?
Or 10.
I gave you 10.
She was going to give you 10.
I'm more generous.
10 minutes because we have
Okay.
We do have Delia with us, and I just saw her on the screen.
Okay, that's good. So under OPW, this is the time of year where each of the House, the Assembly and the Senate, put together what they call their one house budget, what they want to see happen. The governor's budget came out a while ago before we knew that any federal money would be coming towards us. It was during a time where Washington didn't want to give us any money. But then we had an election, and we have Senator Schumer is being very generous. But the thing to realize, nothing's guaranteed. Even though there's $9 billion come to New York State for education, we don't know if a single penny of that is going to go to our 4410 or 853 schools. In the OPW world, it's a little more positive, and we won't find out till the budget is passed on April 1. So the 1% COLA, which is in legislation, hasn't been provided, for, there was one COLA, I think about 8 years ago, and the governor wanted to defer that COLA again, but the Assembly and the Senate want to restore that at a cost of $26.9 million. Originally, the governor had proposed a 1% across-the-board Medicaid cut to our services, and the Senate and the Assembly both are planning to restore that at $10.5 million. Then there was also a 5% non-Medicaid funded programs, a 5% cut, and both houses want to restore that at a cost of $12 million. There's something that the governor called residential program management for an additional $22.7 million. I would assume that has to do with new development, but it's not really defined. But both houses support that. One thing we didn't support in the governor's budget was there's something called Residential Reserve for Replacement, the RRR. When a house needs improvements and major repairs, you used to go to OPW and apply for it, and you get the money. Then they created a simpler way called the RRR money, which gives you money every month that you set aside for when you need a repair. The governor proposed doing away with that and getting a prior property approval for anything over $500, which would have been a real nightmare. So no, the Assembly says they want to restore that money, and the Senate, for some reason, accepts the governor's proposal. Just in case people haven't heard the terminology of the Residential Flow Project, FLOW, maybe Delia can tell us what FLOW means, but it's basically a way to help fill the vacancies in our current residences, which there's quite a few. And the proposal is to have people in state-operated residences who go to voluntary operated day programs move into those vacancies in a very person-centered approach, something that, where they match that home and they know the people. So people would go from state-operated into the voluntary operated homes, and then the state-operated would be used for taking people from the residential schools, the out-of-state residential schools. This is just a proposal. I'm a little skeptical of it, but let's see how it goes. Let's see. Zoom along here. The IBR proposal, the governor proposed to move that over to the Office of Mental Health, New York State Psychiatric Institute. Both houses have rejected that proposal. There is the Assembly is proposing $25 million to reimburse OMH, OPW, and OASAS for providing PPE costs. And let me just digress a minute. It's kind of a shout out to the City Department of Mental Hygiene for assisting providers with getting PPE. And my executive director, Tom McElvenna, was part of that, literally unloading the boxes and distributing them to the providers. And that was big thanks to the city for helping us with that. There's a proposal by both the House and the Senate to provide funding for high-speed internet for state-operated and other residential facilities. So that's it on the OPW side. Again, it's looking very good, but until it's done, then we'll believe it. We don't have a good track record with this administration, so we're hoping our Assembly and Senate partners will pull us through this. Under early intervention, the governor proposed a $11.9 million administrative cut, which both houses are rejecting, and want to prohibit blanket service limits. Also, the continuing of telehealth, which was very essential during this COVID period. And the governor did propose to continue that. A couple other things under Department of Health. There's a proposal from the Senate to prohibit TBI waiver services from transitioning into managed care. So they want to prohibit that. They want to allow pediatric nursing homes to continue serving medically frail young adults up to the age of 21. And some of you may have seen this chart before. If not, we'll send it out, or Chris, you can send it out to people.
Rich, it's Debbie. Sorry to interrupt, but Chris is not here, and I will make sure that when you email it to us, it will be sent out immediately
Okay.
tonight.
Sorry about that. He disappeared while I was talking.
Yes, he did, but I'm the one who gave you more time.
Okay. Thanks.
You're welcome. Now, we know how important what your report is. I apologize, but it's been a little hectic here between a lot of different committees we're on. Apologize for that.
Can I just quickly go into state ed? Because that's where the real crisis is. Because the preschools and Chapter 853 schools, which are schools which serve children that cannot be served by the Board of Ed. They refer these children to the Chapter 853 schools that are run by the nonprofits, and some are for-profits. But during this pandemic, there was a period of more than 5 months where there were no evaluations or referrals taking place because of COVID, and that had an incredible impact on the system. Children were sitting at home, and I think this is the overall crisis we're facing. You've heard about this in the public schools for all children, just the education loss that's been going on, and how they're going to make up for that, and making it up for children who have a disability and should be in preschool. Early intervention reported that there's 10,000 fewer children that have an IFSP right now. That's going to hurt for years to come. And while state ed is proposing some relief through their reconciliation process, that's when they look at the costs, and 2 years later, those costs go into your rate. But 2 years later, a lot of those preschools and school age programs won't be there because they're running out of money. They've run out of money, and they're just really hanging on. So that's another reason to go to the town hall meeting tomorrow evening at 7. And the thing that we've pointed out to state ed and to the governor's office is that all this time when the schools have been closed, the state's been saving money. So why can't they use some of that money they've been saving and give the schools an immediate rescue because they're out of cash. They need something immediately. OPW is getting it, OMH is getting it, but the preschools and the 853 schools are not getting anything for 2 years. So, it's kind of unconscionable. It's discriminatory, and that's what you're going to hear from the parents. That this is pure discrimination against the children in the 4410 preschools and the 853 school age programs. So again, I'll just end it with, there's $9 billion coming to state ed for the school districts. And right now, there's zero guaranteed to the 4410 or the 853 schools. So with that, I'll end my presentation. We'll see what happens.
Richard, this is Deborah, and I'm going to make a quick statement. For years, I've explained that I used to be a parent member from preschool up to high school, and also as a parent member for children who had to be placed in residential. I've always told, but the biggest problem I've also saw is that the Department of Ed plays on that parent. They want the parent, you want your child to be normal, instead of accepting that when a child is very young and they are having issues learning, you see difficulties, that's not the time to just throw them into general ed. They don't want to accept that not everybody learns the same way. So, and everyone's also afraid of labels, when the right labels do get you the help. So unfortunately, the Department of Ed or state ed has played a big trick on parents. I was unusual because I accepted my son's disability and I didn't care about the label. I cared him getting help. So that's a big problem that I've seen for many, many, many years. And I also have a sibling who started in special ed right after Jose P. And he could never have handled general education. So it's very sad because our children, you should get more help when they're very young. And then slowly, after they've had that wonderful faith, then see if they can, be placed in general ed, but this is very sad. And they always try to save their money on the backs of children with disabilities.
Yeah, I don't even have trust in state ed that they even think that deeply. They just don't know how to manage the funds. The early intervention program started in 1994 was
Yes.
specifically to get to children as early as possible and then on to preschool. So maybe by the time they're 5 or 6, they can be in a nice integrated class and get itinerant services. And that's all kind of crumbled now. And now they have to get it back on track. And
I agree with you. And unfortunately, early intervention was when it used to be in to the family court, but now they finally got it out in 1994. We have to advocate also for the youngest ones too, because we'll go back to the way it used to be, where the children were so far behind that they're falling through the cracks again.
right,
So I thank you very much, Richard,
you're welcome.
everything you've said. And Christopher will, when he gets back, by tonight, I will make sure that he puts on anything you want. Just email everything to him, and I will see that it's placed on correctly. I'm sorry, I'm not as IT smart as him. That's where my disability is. But again, and
Thank
good
you.
luck. We appreciate. Okay, next, and please everyone have patience with me. Okay, is Delia on, or is Delia Shep, are you on?
I'm on. Can you hear me?
Yes, I can. I'm sorry if I can't change the picture. I'm very,
It's okay. I like Richard's picture. It looks great.
thank you so much. I
Thank you,
apologize
thank
for my lack of, I'm so sorry.
No problem.
Okay,
It's great. I'm glad to hear all of the other presentations. So I do want to give a couple of regional office updates. Unfortunately, we're spread a bit thin in the regional office, and we have a number of meetings going on today. But I wanted to let you know of a couple of staff changes that we have. On the phone, typically we have representation from Lucy O'Mazey, who I believe is on right now. She's usually, pretty consistent with joining these meetings. I think she's on. I thought I saw her name. Yep, she's on today. And we have new additions, which is really great for us. I don't think that they were able to stay on longer. We've been able to add some deputies, which has been a long time coming. We have acting deputy directors in the region. So we have Michelle Giuliano, who's joined us from Long Island. She's from the Long Island Regional Office. She will now be working in the New York City Regional Office, as well as Nina Gritze, who is another acting deputy director, who originally was working in capital finance and has transitioned over to the regional office as well. So unfortunately, everybody's been, kind of doing other meetings. So they were planning to join earlier on, but there were other presentations, so they couldn't announce themselves. But hopefully you'll see them at other meetings, and you'll be able to get to know them.
Delia, I just want to say that the advisory council always does an outreach every other month, and our guest speaker is Lucy O'Mazey, and maybe everybody can speak then, because we're trying to let our families know who's who. But I appreciate that you stayed on and explained that to us. Thank you. And I'm glad to hear that we're getting more help, because you guys really work very, very. I really know how hard you work, because even though you have so-called, talk to me like one title, you guys have to do like 20 jobs at the same time. And I appreciate that.
Well, thank you. Thank you for saying that. We've, it's been a long time coming. We've been without a director and other deputies in the region for a while. So we've been trying our best, and we appreciate your patience throughout this time. And we will ask for your patience a bit longer while we're in transition. So, we'll continue to do our best, and we love to hear feedback from you, and we want to make sure that the communication continues. And so we'll be coming to these meetings,
Thank you. fact, you're always, when we do send the list, well, Christopher and I put the list together, and then we send everything and do keep it on the advisory council's website and any updates. But we'll either try to get it on tonight or by the weekend. It depends on how everything goes, because the reason Chris left is he's part of due to the untimely passing of Miss Prentice, Christopher had to take her place at a press conference because they're both on ADA task force for the MTA and Long Island Railroad. So that's what happens when you have to do 3 a year, and that's why we understand completely.
Yeah, everybody's pulled in different directions. We got it.
Yes, we are. Yes, we are. They pulled very hard. But is there any other updates or that you have?
Yeah, I want to touch on a couple of things. I heard Anna's presentation. I want to let you know that we work very closely, not just with the State Department of Health, but also with New York City Department of Health. One of the things that we've been dealing with a lot is vaccine hesitancy, with the population, but also with staff. So we continue to promote vaccinations, in the field. We also work with CCOs to make sure, and providers to make sure that everyone has access to vaccines, and that there's, not just access to vaccines, but that everyone, has information that they need and is able to promote COVID safety in programs as well. Just to, I know that Richard touched on the budget issues that were going on. You're aware of the, the American Rescue Plan and how that is going to hopefully bring some relief to the state. He mentioned FLOW, or FLOW. It's the one time that the state hasn't created an acronym for something. It's actually just FLOW. So really what this is, this is where the state is really trying to actively manage residential programs to make sure that people that live in settings are appropriately aligned with
Sorry
their,
about that, Delia.
yeah, so we're trying to make sure that people are actually aligned with their needs and where they live. And so, when we have, about 110 individuals that have aged out of state residential schools. And, we have some maybe lower needs individuals living in state operated group homes. The idea is, obviously using person-centered planning, taking a look at offering those individuals that live in state-operated homes an opportunity to live in voluntary operated residential settings, and then offering the individuals that have aged out of residential schools an opportunity to move into the state-operated group homes. So it's creating flow within the system.
That's it. That's very good to hear.
Okay, so hopefully that makes sense. And this would, potentially bring an $8 million savings to the system.
Well, that's good.
So I just wanted to clarify that.
Appreciate that, because we do get mixed up.
Yeah. So we're working very closely with our providers. There's a lot of discussion around that. I imagine there was discussion perhaps at this meeting or other meetings about an announcement that went out on February 24th about the 20% withhold. There was a memo that went out to providers about that, and how, did you guys talk about that at one point?
There's not really well, Joyce could have brought it up, but she's also left. She brought it up, but was brought up at previous meetings and also the town hall.
Okay, so just to,
and it was also brought up at the statewide. It was brought up at the statewide, which I attended, but not everybody here attends that. But you want to
just want to make sure everyone's aware that we've begun the process of repaying those funds that were withheld. So that, basically, that happened August 21st of 2020. There was a 20% withhold that was implemented. We have begun the process of repaying those funds. Also, recently on March 25th, we did announce that we're not going to be rebasing the provider reimbursement rates that for 7-1. essentially because there's going to be a change to the rate methodology as of October 1st. So that was announced recently. There's also some changes to some OPWDD initiatives, that some regulatory flexibilities that have been discussed with the provider associations. We're examining these regulatory flexibilities. We're looking to provide some clarity and consistency regarding the front door process and pro processes. We're essentially looking at a risk-based oversight strategy for audit processes. We're looking at improvements to the care management function and training. We're also looking at revising the community placement procedures. Those of you that have been that are in residential are aware of that. Also looking at improvements to the MOLS contact access. We're looking at streamlining training requirements for medication administration and SKIP-R. And we're looking also at examining agency supports for children with residential services, and making improvements in cross-systems program for supports for children in residential programs or CRPs. So those are some regulatory flexibilities that we're looking at. And the other big item that we haven't done in a long time is the 507 plan. So we'll be looking at undertaking the 507 planning process, and we'll be sharing some data with local government units and engaging stakeholders. So there will be some stakeholder forums that you'll all be a part of at some point this year. So just keep a lookout for that.
We will. Adelia, I have one that I just want you to know, I did bring this up at the statewide, and I did have, I asked everybody, and then I'm also going to ask you and ask you to spread this to the other directors in our area. The local pharmacy said they would take our individuals who live at home if they get a letter or something from OPWDD saying that they are now part of they can be vaccinated also. So we did ask that. We did it. The commissioner was on. I did ask him directly. So I'm just asking if New York City can make sure, because I have to say a lot of the individuals, that families told me they would like to, if possible, get the vaccines at some of the pharmacies. So if you could just let my CVS, Walgreens, Rite Aid know that that they're allowed, it would be a big help.
Yeah, so I mean, I did hear the response from the doctor, from DOHMH. You know, it has been my experience, even in trying to schedule vaccines, that some of the pharmacies have some specific restrictions where either they're only vaccinating certain groups. You know, people with intellectual disabilities do qualify under the underlying conditions criteria. So, you know, that is, they are eligible under that criteria. So that shouldn't be an issue. Is that your question? I couldn't hear.
It's more of a, it's not a really question, it was a statement, because my cousin is of the age and she went to be vaccinated at a local pharmacy, and I asked the head pharmacist who knows my son perfect, and the family, but I asked her, and she said she doesn't dispute what I'm saying, but she says they need official paperwork in to them, to the main head pharmacist, not like her, but in their organization. So what I'm just asking is, can you please make sure, because I asked it for upstate, you know, when I was on the statewide, but it's very important. I want, because sometimes it works better if they can do it with their local pharmacist, but I just want to make sure that they understand that our population meets that criteria.
Okay, so you're saying that the individual was not asked for proof. You're saying that they won't do it. They won't do it. They're not.
They wouldn't do it. They will not do them. They will not take them because they need proof.
Okay.
because they're following
Was this a specific pharmacy provider? Was it like CVS, Walgreens?
it was all of them because
All of them?
yeah, a lot of families called me and emailed or texted me, and I said, okay, I'll bring it up. So we
Okay.
just want to make sure that they understand that OPWDD, and I don't know who to email it to in the CVS, Walgreens, Rite Aid, maybe.
Well, you know what? I think this is probably a New York State DOH issue. So let me elevate this issue. Okay. Thank you for bringing.
I appreciate it because the families didn't want their names used.
No, I understand. All right. Thank you.
Thank you. Do you have anything else?
No, I think that's it.
Okay. I want to, let's see, who else is here? Okay. I want to thank you, Delia. And now I'm going to do my best to, okay, next I'm going to do my report very, very quickly. As you heard part of my report, yes, I was up in, I didn't go up to Albany. I wish I could have, but we couldn't because of COVID. But we did meet, and we did know about the proposed possible budget cuts, but this was 2-3 weeks ago. And yes, all of the 19 councils across New York State will be advocating for our funds for OPWDD, and we're talking to our local elected officials, whether from city council up to our United States senators. We also brought up the issue I brought up about the vaccine. And I am keeping my report very short because I want to make sure that the other subcommittees get their reports in. But I do wanted to say that I appreciate that Delia told us about our new acting deputy directors, but on April 14th, that's a Wednesday, and information will be sent out. Lucio Mezzi will be our guest star, and we say that way because she will update us all on what's going on in our Brooklyn DDRO, as we are the Brooklyn Family Support Advisory Council. And yes, I will continue, and as long as this epidemic is in place, the DD Council is always welcome to be co-joining with us. But we will be doing this we'll be doing our outreach that Christopher usually hosts, so that everybody will know who is who in our Brooklyn DDRO. My next report, I'm doing this for Ms. Rose Saul, who is chair of the Care Coordination Committee. We met on Wednesday, March 10th, and we have a request. We'd like if anybody here, whatever CCO you're from, we would appreciate if you would send more of your CCOs to participate. And we did discuss about the COVID issues our families were facing. But the big important thing is, you see, before we had CCOs and care coordination, there was Medicaid service coordination. And we would have different MSCs from different agencies come in, and everybody we'd update what's going on, how to help each other, were there new issues or whatever, to help the fellow MSCs could help themselves. And we did have families at times to explain issues we saw that maybe we didn't understand. So we will be not meeting until May. We're not meeting in April. The meeting is supposed to be approximately May 12th. It may change. And Rose Souls will let Christopher and I know, and it will be placed on the website. But we do ask, please, CCOs, the 3, ACA, Care Design, and Tri-County, please send more of your care coordinators in. We really want to all work together, and parents, you're welcome also, because we have to make sure the system runs well. Our families and our most important individual children need the services. So that's all for me. Now, Carrie, are you here? Can you please give the report to the Children's Committee? You need me to unmute you, or you can't?
I'm good.
Thank you, Carrie. Hi.
Yes, I'm here. The Children's Issues Services Committee met last month this month on the 10th.
You mean the 9th? You're due to Tuesday.
Oh, okay. Sorry about that. I wrote it down
Sorry.
wrong.
Yeah,
I do
no,
have
just want to make sure.
dyslexia and dysgraphia. So I
That's
do.
okay, I do that, too. I have that too.
So we met. We heard from the new DDRO transition liaison, Scott Young.
Yeah,
Was that his name?
yes, yeah, he was also the next day at our meeting.
Right. Yeah, so he introduced himself, and that was nice. We talked about our upcoming, that we have a speaker for our upcoming program in May on parental mental health. We're looking forward to that. And then we talked about the transition fair, or the meet and greet, provider meet and greet that will be on April 21st. Between that and some subsequent meetings, we've made some decisions, such as it will be on Zoom. Providers will be presenting. It will focus on DayHab. And it will be translated into Spanish and Mandarin. And we're starting to get the publicity out now. Where we really need the council's help, of course, is in getting the publicity out, because it's not as easy as it used to be. It was never easy, but it's
Right,
not as
true.
easy as it used to be, because we
have
don't.
the flyer, but
Yeah.
I'm having trouble pulling it up, and I don't want to disconnect anybody.
Okay.
So
So
I apologize.
that's all right. If you could send it around afterwards.
Oh,
if you
yes,
were,
we will.
Chris. Yeah.
Chris
So
can do that.
we do have a flyer. We're ready to go with that. Mainly, we need to get the flyer into the hands of individuals who are aging out, or who will soon be aging out, or for that matter, the 2020 grads who have aged out and may not yet have their placements. And we need to get it into the hands of families. So if you can help us with that, really appreciate it. This is the whole process has become so much harder and so much more fraught, and this is probably the one place where they can people can come together and get a lot of different information, from different agencies. So that was pretty much the focus of our meeting, and we will be meeting again on the. I don't have it in front of me. I wasn't really expecting to do this report, Deborah.
I understand.
But we will. I believe it's the second.
I'll give you the date. I have a gigantic calendar, if you could see.
Oh, good. I'm glad somebody does.
It should be April. No, you're the second. You're the 13th. April 13th.
Sounds about right. April 13th at 10 in the morning. You can get the link from Chris or Deborah.
Yes, we will have the link. And one thing now, I'm going to. I know that I appreciate that you brought up the information that the Brooklyn Public Library can help Brooklyn residents get their vaccines. We thank you for that. And we also want to say that we appreciate all the work you've been doing, even though you can't completely go into the libraries.
No, well, thanks.
So,
cool. Can I make a quick announcement?
Yes, you may.
Thank you. I am really, really excited to announce that Marenke Jiwa Anewu will be joining us in April to launch her new book, Sincerely Your Autistic Child. This is a bunch of stories gathered together by autistic authors, talking to parents about what they wish their parents had known when they were young. I'm sure you all know Marenke. She's a national speaker. She is autistic, non-binary, and African American. Her family was her parents were from Nigeria, and she has 4 autistic children. So she really knows what she's talking about, and she
definitely would.
Yeah, she is an amazing speaker, and her new book pulls together voices from around the country, from all different backgrounds. And it's really exciting. So that will be on April 28th at 5 o'clock in the afternoon. It's a cocktail party without cocktails.
You can have a cocktail at home.
I'm sorry?
You can have cocktails at home.
You can have cocktails at home, yes. I plan absolutely to have, by that time of day, my non-caffeinated tea.
That's what I.
So,
by the way, I just wanted to give in reference to about the mental health, so that the new chair of the subcommittee for minority women with mental health issues is Assemblywoman Matilda Frontes. So maybe we can get her to assist also.
That'd be great if you could connect me. If you could
Fabulous.
connect Teresa Del Fiore, who is the chair of this committee, and I to her, that would be great.
Yes, we will.
Thank you.
Thank you so much. And also one other question, reference with the libraries. You can only bring in and out stuff. I see some of the only there, you can't go past where you drop books in and out. Is that true?
That is still true, yes, but we are rapidly moving to lobby service and hope to be there, I believe, by the end of April. It depends on community transmission rates, of course. But yeah, and it will be a limited service. We're not bringing everybody in, and there will still be restrictions like no children under the age of 14 without their parents. And we will encourage people to, not the whole library will not be open. It will be distanced. People will have to wear masks. This is not a debatable question. We hope to get this moving soon. And, you know, you may have noticed that libraries are open for, as you said, drop off and pick up of holds and things like that, and some very limited other things. You know, it's been a little inconsistent. Some of our libraries close, they reopen. And, you know, frankly, we want to thank you for your patience with that. But, you know, when we close a library, it's because of something outside of our control, like, you know, staff shortages, or there's been exposure in the branch, or in some cases we've been able to sort of push some construction projects through, but those are anticipated. But so please do check the website before you go to your library, even for that curbside service. So
I want to thank you so much, Carrie.
Thank you.
Doing the children's report, the library, and all those important services. Thank you.
Thank you for your support. Bye-bye.
Welcome. Bye-bye. Mary Christopher, where are you here? Hello, Mary. Can you unmute?
I'm here. I unmuted myself. Yes.
Hi, Mary. Before you say anything, I want to apologize, but I'm having trouble clicking on to get your flyer up. I apologize.
That's fine.
I'm not as technically savvy on the computer as Christopher.
No worries. We're gonna get it out there. You know, and you know, that doesn't matter for today, because I trust that Christopher will have it out, you know, as soon as he can. So we're in good hands with that.
Yes, I promise you that.
So to piggyback off what Carrie had said, you know, throughout this year, the transition committee has kind of been trying to figure out a way to get the information for what, you know, the providers are able, the services the providers are able to provide, and to get it out and make the connection with families and care managers, and it's really been a huge challenge. So the Manhattan DDRO actually had an event similar to what we're planning in February, and you know, and I'm a colleague of the chair of the Manhattan committee, the co-chair of the Manhattan Transition Committee. So I with his blessing stole his idea, and so
okay.
You know, and so as Joyce said, you know, with Carrie and Matt and Joyce and Joy, we've been working on pulling this event together. And so we looked at where the highest level of, like, in terms of services, the need really seems to be with the connection of day hab. We're looking at our graduates in June 2020, who many of them currently don't have placement in a day hab program. So we want to get them involved in this. We have a whole crew of 2021 graduates who are aging out in June, and we want to be able to connect the parents. I mean, it's been very challenging, you know, being able to explain to parents what's available, because it's an evolving process. And so we want the providers to be able to talk about, you know, what they're able to offer today, and how they see their programs looking going forward. So that's a really important piece. We want families to hear that, you know, and so we really decided that. And also, I mean, I would say, even to bring it back, you know, go further back to the students who are going to be aging out at age 22, just so that they get started early, because, you know, there's a huge backlog. I mean, things are, you know, across the board, I think, when it comes to services.
Very, very huge.
Yeah, so we want to be proactive in getting this information out, and kind of make up for the fact that we didn't have the information prior to now. So, we're working, I have 13 day hab providers who've agreed to present. We're going to ask the CCOs to do a small piece, just basically saying that, well, if you want these services, you need us, kind of thing. So that's basically going to be the gist of it. The planning's going fairly well. We've got the agencies to commit. Really, the ticket is getting the information out. I'm covering the District 75 piece, going to try and get it out to some of the community schools that have like ACEs programs and things along that line.
Yes.
Just to let people know. But I'm going to rely on the CCOs to try and get some of their care managers in, because we're finding, another outcropping of this pandemic. It seems like the turnover rate for care managers has been even more so than it has in the past. So with that turnover is new people coming in who don't have this information readily available. So we want to get the care managers involved to hear this. So, we're optimistic that it's going to come together and it's going to be a successful event. This event is, like I said, the focus is primarily on day hab. If this goes well, we will plan to have future events that involve other services that people are in need of. But it seems like at this point, the day habs need to figure out how many people need to be coming in and how they can do their intakes and get the information about what they can do out, and the families that need that service now need to hear this. So if anyone on here has questions about it, you can feel free to email me. But going forward, it's going to be good. And really just a matter of getting that information out there. What Carrie had said, I think I'll ask her to share that with or share it with the case management. When did you say you guys were meeting again, the case management committee?
They're not meeting until May, but
Okay.
but Mary,
Mm-hmm.
number one, Christopher and I will be making sure it gets on our website.
Good. Okay.
And that we have a very large distribution area. We also, knowing that we will make sure that all the elected officials have that information, as well as there's 18 community boards that have education committees.
Good.
We'll make
Okay.
sure they get that. Of course, there are other forms. We can do it on Facebook, Twitter, but we'll see to it that it's constantly shared.
Yeah, let's keep pushing it out. Okay, good.
So when the advisory council, well, the DD council, but we work as a team to make sure that this is put out and that people understand the importance, and we will see to it that your flyer and whatever other information you want sent out will be done.
Okay, and we also are going to ask Mr. Young from the DDRO just to do a brief introduction in the beginning, to just put the name to the face of who the transition person is. So I mean, it will come together. We are optimistic, and like I said, any questions or anything, but that's basically the main focus of the transition committee, and and other members of the council who jumped in to help put this all together. Everyone's been great. It's going well. So
yes, it will, and I'm very optimistic it's going to go well, because even though we all are suffering for this pandemic, we know that services have to continue any way possible.
Yeah.
So we will
We'd love to return to the day where we could have our family support fair, and our transition fairs and all that. But I mean, the thing is, we gotta work with what we're given. So I mean, that's basically what it comes down to.
We miss actually meeting in person, but we've accepted that this is, but we have all to make sure to do as much outreach as possible.
Right.
And we will, the advisory council, since we do run the website and help the DD council, we'll make sure that it's been very well spread out and advertised.
Sounds good. All right.
Okay.
All right. Thanks, Deborah.
Thank you, Mary. Okay. Now, to see that, wow, I didn't mess up anything yet. Does anybody have any announcements to make? Go one at a time. Raise your hand or unmute yourself, and I will, because we're going to try to stay on till 12. Anybody have any, hello, anybody?
Hi, this is Tammy Brown from Advanced Care Alliance. I'm just want to put it out there that I'm hearing you guys and your requests for more care management involvement, and I would really like to see what I can do to get more of our care managers involved. The young lady who just made the announcement, I was going to put my email in the chat. I've really been boosting our Facebook and social media presence, both internally and externally, as a way to engage care managers, families, and members. So if you have information that I can share to our internal website,
Tammy,
by all means.
this is Deborah. Please email Christopher and myself
Okay.
at our email. It's, as you'll know, it's in lowercase, letter B as in boy, F as in family, S as in son, another S as in son, A as in apple, C as in cat, at yahoo.com. That's the email. Please email, and then because we have made so many out, we've emailed and Facebook, different people we know that were with ACA, and I'm very glad that you are here. I don't want you to take it or any of the that we're upset. The part I would say that we may be upset because we want you to have the information. We want to
Yeah,
you.
I definitely don't think.
Crisis. This is the crisis. We're in a crisis right now.
Absolutely.
And they're suffering, and we want to make sure that they
Absolutely. And we're all on the same team. I don't think that you guys are mad. I just want you to know that I'm available. If there's anything that I can do to increase the presence from our perspective, I want to be able to do that. So let's
Please
definitely
email.
connect.
I gave you the email to reach because Christopher and I both I'm the chair and he's the chair of the outreach, but on the DD Council, he's the chair and I'm the secretary.
Okay.
But what I'm asking is by emailing me, we can then work together so we can make sure that ACA, because I know Tri-County's made it to the meetings and so has Care Design, and when we don't see you, we're like, what happened? And we're just, that's how, it's not in any, like, we want to know because it's important, okay?
Sure, absolutely. I'll email you. Thanks.
Thank you so much. Is there anybody else who has an announcement or wants to? Please unmute yourself.
Hi, this is Terry.
Hi, Terry.
From Adapt Community Network. Just letting you know that we have lots of money for family reimbursement for all the boroughs and Queens as well.
Okay.
So please apply. And I also have openings for home modification and repairs for all the boroughs through Access to Home Grant.
Okay.
So since your chat doesn't work, I tried it.
Email me. Just email us, okay?
Okay.
So the chat, there's been a few little, remember, unfortunately, I apologize, not technically advanced as Christopher. This is where I'm DD. So you email me what you just said.
I will email you, and then just remember if you need any assistance, to Project Connect at adaptcommunitynetwork.org, and that would be the main place to send an email. But I will send you that email.
Please send me your
so much.
information. You're welcome. We will make sure that we will see that it's put on the website. If we have to email, we will. If we have to put it on our Facebook page, we will do that. But thank you.
Good morning, Deborah.
Hi, good morning.
Good morning, Deborah. Good morning, everyone on the call. This is Jessica Williamson from Tri-County Care. I am the intake and outreach specialist. I work in the boroughs of Brooklyn, Queens, Manhattan, Bronx, and I'm also outreaching in Westchester areas. I do have some announcements in regards to Tri-County Care's advocacy campaign. Everyone is on this campaign, but Tri-County Care's individuals and enrollees are being given information regarding COVID vaccine updates. Our care management team is also filtering reminders to families to inform them of the COVID vaccine sites. And individuals now are of the age of 50 plus are qualified for priority COVID vaccines. This is the information that we're giving out to our enrollees and individuals. Also, our enrollment efforts are the same as before. We are continuing to help families through the enrollment process, OPWDD eligibility, Medicaid waiver application, and also completion to get the care manager assigned to individuals. We're continuing the eligibility process regardless of where people are in the process, whether they have attended a front door session or not. We are here to assist with every step of the process. We are continuing to send individuals out for evaluations to assist them with getting psychological, psychosocial evaluations, and also autism evaluations. We are making referrals over to Article 16 clinics, and we also have an in-house psychologist in the Bronx that is out of pocket. We are paying for that evaluation with our psychologist in the Bronx if a person does not have Medicaid. We're continuing, as always, to be proactive with our transition coordinators, parent coordinators. We are contacting Article 16 clinics and all agencies to make sure we can get as many referrals as we can and get people through this long, lengthy process of OPWDD eligibility. Again, my name is Jessica Williamson. My information has been supplied to the chat, and I think Deborah and Chris will make sure that information gets out. I'm looking forward to speaking with you all. If anyone has any questions for Tri-County Care, you may reach me at 844-504-8400, and my extension is 9298. Thank you all. Have a great day and be safe.
And Jessica, thank you very much, but also I'd appreciate if you find that some of your families have tried to get their child vaccinated, but with COVID, and they've had issues, please let each borough that it happens to the advisory council. We are taking this very seriously and advocating. Also, if individuals don't have Medicaid, Tri-County can help, but also we have other agencies we have listed. We also have, I know CARES has a lot of openings for individuals and families, they don't have Medicaid. So that it will be on the website. If you need, the website is www.bfssac.com. Is there anybody else who has an announcement they would like to make?
Yes, hi. I'm Juliet Hawkins from New York State Institute on Disability.
Okay, Matthew, I'll let you on afterwards. Go ahead, Julia. Go ahead.
Okay, so we have openings for behavior management in Brooklyn. We work with the parent to help them learn how to deal with the challenging behaviors. We also support the parent in stress management. My number is 917-524-4856, Juliet Hawkins. That's one program that we have immediate openings in. We also do evaluations for people who do not have Medicaid and are looking to get OPWDD eligibility. We do that in the boroughs of Brooklyn, Bronx, Queens, and Staten Island. And the contact person is Elizabeth Sunshine, and her number is 917-699-0578. We have a contract where we provide transportation services for people in Brooklyn, Staten Island, and the Bronx, you know, to get them for emergency respite, camp, recreation, medical appointments. The person to contact is John O'Grady, and his number is 917-747-9424. And we also have openings for reimbursement and also some tickets for limited tickets for recreation. The person to contact is Jackie Tripodi, and her number is 718-494-6457. And my colleague has, Doris Kahn has put this in the chat. Thanks.
Thank you very much. Matthew, I know you're on next. Matthew from YI. Go ahead, Matthew.
Yes, thank you, Deborah. Hello, everyone. This is Matthew with the YI Link Department. We do have evaluation grants available for Brooklyn families who don't have Medicaid. And in addition, our Premier Healthcare is currently doing the COVID, testing, right? So that's the rapid results, the PCR, and the antibody testing. In addition, we do have a limited supply of the vaccine. So at this point, the families don't reach out to the clinic. It is the clinic that reaches out to the families to see if they want the vaccine. All right, and right now it is limited supply, so that's why it's the clinic reaching out to the families.
Okay. All right.
Um,
Anything
in
else?
addition, our Article 16 clinic, continues to have psychological, psychosocial, and autism testing through Medicaid.
Okay. We appreciate that. Thank you, Matthew. That's it. Why I link?
Yes,
No problem.
we can always be reached at 212-273-6182, or you could always email us at link, L-I-N-K, @yei.org.
Thank you, Matthew. I appreciate
You're
that.
very welcome, of course.
Yeah. Anybody else has an announcement? Please unmute and stay.
Hi,
Hi, and this is?
this is Minnie Berman.
And you
I
are?
used to be a director at Urban Resource Institute
Yes.
for a vocational program. And we recently transitioned to become part of Goodwill, New York.
Oh, good.
And we just started our program. It's called Brooklyn Prospects.
Mhm.
It's a vocational program. It's funded by DOHMH, and people do not have to yet be eligible for OPWDD services in order to start receiving vocational support services such as work readiness training, job placement, and job coaching. We do help along with the CCOs to help people get into OPWDD and then transfer them once they're on the job to a long-term support in SEMP, which is an OPWDD supported employment program for long-term job coaching. But we can start the process right away without people having to get into the waiver and all those long processes. So that's why we have a grant from the city, so people do not languish with this goal of employment. They have a chance to get started. We just need to have some proof that there was a diagnosis at some point for intellectual developmental disability. And then we can also refer the person to more testing for more recent evaluations to be used by OPWDD. But we can start people off if they've ever been in Access VR or from their school, any kind of records to show that they have a developmental disability will get the person admitted. They also have to be 18 years of age and up and motivated to work, of course, but they don't necessarily need to know exactly what it is they want to do, because we'll help people figure out and explore their vocational strengths and abilities and interests and help them choose work. Goodwill also has the complement of all the different services in every borough of pre-vocational programs and SEMP, which are OPWDD services. And so we will be working together with these other programs to transition people into the right service.
Okay.
So if anybody's interested in a job, we just started the program on site. People are coming to the program, they're socially distanced, all the precautions are taken. And right now we're on 154 Lawrence Street, but we'll be moving sometime in April to 25 Elm in downtown Brooklyn. So, but people can start at this time, it's fine. It's a few blocks away from the new site that we're renovating now. So If anybody has any further questions, I'll be sending some information so that it can get on the website. If you want to call me and get more details, you can reach me, Minnie Berman, at 347-439-7078. That's 347-439-7078. Thank you.
Thank you, Minnie. Anybody else? Unmute. Go
Hi.
ahead. Hi.
Everyone. Hi, this is Deisha, Family Support Outreach Coordinator from GHO. We have a program, waiver programs in Brooklyn Borough as well as other boroughs. We have openings in employment. They have without walls, immediate opening, COMHET, weekend respite, family support service coordination available. GHO is one of Care Design New York CCO enrollment contractors in New York State. We assist families whose English language is limited to enroll with the CCO Care Design New York. The program flyers will be mailed to Chris and Deborah, and also, okay, my number here, 718-307-6570.
Someone else, you. Go ahead.
Okay, my number here, 718, which is your.
Let's give it a few minutes to have everybody join us.
Excuse me, we're still meeting here. If you please mute. Go ahead, sorry.
Okay, my number here, 718-307-6570. We will host ABA verbal behavior seminar with the Kids Alice on April 7th at 11 by Zoom. This time we will host it in Korean for Korean families. I'll also email this flyer to Chris and Deborah. Thank you. Any questions, reach out to me. Thank you.
Okay. Thank you. And now it's getting very close to 12 and everybody wants to go on there. Let's see, who is this? Okay, the two participants who raised their hand, I'm trying to see you. Okay, unmute. All right. Anybody else has an announcement or something? Please let me unmute. I can't, let's see. Okay. Well, ladies and gentlemen, we've actually reached 12 p.m. and I know there's another meeting coming up. And I apologize if you didn't get to say your announcement, but I will tell you that you can, as I said, put it on the website, and then we will see that you send it to us and we'll get it on your website. So again, I thank everybody for participating, and please, everybody, have a great, safe day. And I know there's another meeting right now going on Facebook for and more advocacy. So good luck, and thank you again for being patient with me. Thank you. Everybody have a great day. Take care.
Bye.
Bye.
Thank you,
Bye.
Bye,
Thank you,
everyone.
everybody.
Very much. Bye.
Thank you.